and integration of prescribing, dispensing, administration, and monitoring guidelines. Advanced case-based MCQs, hard difficulty. Q1, dilution error in ICU. A resident prepares IV norepinephrine infusion from 8 mg 4 milliliter ampoule, but writes only norepi 4 milliliter on the label without mentioning the base equivalent. What risk does this pose, and what is the correct practice? A, no risk. Volume is enough for identification. B, risk of overdose due to confusion between salt base strength, always label in nanograms per milliliter of base. C, risk of underdose, pharmacist can correct later. D, safe if double-checked by a nurse. Answer: B, risk of overdose due to confusion between salt base strength, always label in nanograms per milliliter of base. Explanation: DRAP HAM guidelines highlight that norepinephrine must be prescribed administered as membrane of base, not tartrate salt, to prevent dosing confusion. Q2, wrong route administration. During an emergency, a nurse mistakenly connects a syringe with oral midazolam solution into an IV cannula. Which system-level strategy would have best prevented this? A, competency-based staff training. B, use of oral syringes incompatible with IV lines. C, double-check by physician. D, barcode medication administration. Answer: B, use of oral syringes incompatible with IV lines. Explanation: DRAP HAM guidelines recommend route-specific syringes devices, oral syringes that cannot connect to IV lines, to avoid wrong route administration, a la K-alike chemo error. A pharmacy technician nearly dispensed doxorubicin HCl instead of liposomal doxorubicin due to look-alike packaging. What is the correct preventive measure? A, allow interchangeability since both are chemotherapy. B, store separately with auxiliary do not interchange labels. C, keep both in crash carts for convenience. D, dispense only after oncologist approval. Answer: B, store separately with auxiliary do not interchange labels. Explanation: liposomal versus conventional forms must be stored separately with warning labels, as mix-ups can cause fatal toxicity. Q4. In Agement A, patient was discharged with insulin vials but was not educated about distinguishing between short-acting and long-acting insulins. He mistakenly injected 40 units of long-acting instead of regular insulin before meals. Which safety principle was missed? A, double-checking during prescribing. B, patient education on drug identification and timing. C, procurement from legitimate sources. D, proper cold chain storage. Answer: B, patient education on drug identification and timing. Explanation: DRAP HAM guidelines stress that patients must know the name, appearance, and timing of hams like insulin to prevent self-administration errors. Q5. Sedation in PA pediatric resident prescribes midazolam 0.5 mg stat for a 2-year-old without weight or route mentioned. What is the primary error? A, missing allergy check. B, ambiguous and incomplete prescription for ham. C, wrong drug choice. D, dose within safe range. Answer: B, ambiguous and incomplete prescription for ham. Explanation: ham prescriptions must be clear, unambiguous, with dose, route, weight, indication, and instructions. Abbreviation statements like stat without details are unsafe. Hack Q6, monitoring gap. A patenting IV heparin infusion for DVT develops bleeding. It was later found that no baseline or follow-up coagulation test, APTT, was performed. Which guideline principle was violated? A, dispensing in unit doses. Monitoring of therapy with relevant labs. C, proper ham storage. D, limiting nursing floor stock. Answer: B, monitoring of therapy with relevant labs. Explanation: ham guidelines mandate lab monitoring during anticoagulant therapy to prevent serious ADRs like bleeding. Q7. Verbal order risk during surgery. It is verbally instructs a nurse to prepare Epi 1/1000 injection. The nurse misheard and prepared 1/10,000 instead. What two principles were violated? A, no abbreviations plus no verbal orders unless emergency. B, double checking plus patient identification. C, correct storage plus standardized dilution. D, nurse training's lookalike policy. Answer: A, no abbreviations, no verbal orders unless emergency. Explanation: abbreviations epi, norepi, and verbal orders increase LASA risk. DRAP advises full names and restricting verbal orders to life-threatening emergencies. Q8. Crash cart standardization. In Hospital A, ARTS stock epinephrine in 1 mg per milliliter vials, others in pre-filled syringes, and others in different concentrations. What is the risk and correct measure? A, no risk if staff are trained. B, risk of dosing errors. Standardized concentrations across all crash carts. C, more options improve flexibility. D. Safer to let pharmacists decide on concentration each time. Answer. Risk of dosing errors